Okay, so for this self-help video, we are going to focus on the ankles. And this is my son-in-law, Nick. He is going to follow me as I describe this. So you can do this to yourself. You can see that we're sitting on the edge of a massage table. You could sit on the floor. You can sit in a chair. You can pretty much use any surface that you'd like, okay? So the first thing we're going to do is we're going to start with some range of motion. We're going to start just by moving the ankle around. Both directions. Make sure you go both directions. Let's go up, down. Just move it in whatever way feels good to you. Go around and around, make some figure eights. All right, first thing we're going to do is we're going to try and open up this front of the ankle. Okay, so if you come in here with your fingers, you can just feel that there's generally tension along the front of the ankle in these tendons. I'm going to have you take one hand across the bottom of your toes and the ball of your foot. You're going to bring that foot up, bring the toes up, and just kind of compress. And we're going to hold that. This is going to release all the tendons in the front of your ankle, really opening up the congestion and the adhesive material in the front of your ankle. Okay, you're going to hold this for about 20 to 45 seconds. Keep holding that. When you're done, you're going to come back in and you're going to feel that tissue again, just to see if it opened up. Plus, it really likes to be touched. So go ahead and let that go, Nick, and just come back in here and just kind of feel that. So you're just doing a little self-massage here. Now, I don't know about you, but that actually feels better to me. Okay, so next what we're going to do is we're going to move down to the back of the ankle. Okay, we're going to move this bottom bone here back and forth. Now in a lot of people this bone is pretty stuck. So we're going to shift it. We're going to bend the foot in like this, yep, and just hold it there. And again, we're going to hold this for about 20 to 45 seconds. Now this is actually going to release this ligament here on the inside of the ankle that's called the deltoid ligament. This ligament gets really tied up in most people, particularly if you've had any kind of ankle sprains. Most ankle sprains happen on the outside. We call them lateral ankle sprains. And yet it's this inside ligament that can actually tie up your ankle for years after the sprain. So this will help release that. We've held that for about 20 seconds. We can hold it for 20 to 45. We're going to release that. And again, just come in here and kind of move that around. Feels pretty good?
Yeah. Much looser.
Much looser, he says. The next thing that we're going to do is we're going to come down to the bottom of the foot. Just place your finger kind of in the heel. So you're not in the middle of the heel, you're a little bit closer to the back of the heel, but you are right in the middle from side to side. And you're just going to come straight up and just a little bit. This is not a big movement. You really want your pressure to hit about right here. So you're not looking to come all the way up into the leg. And you're just going to hold that. This will actually help open up the joint between the bone that's in your ankle, the talus, and your heel bone, which is called the calcaneus. So we're going to hold that for our 20 to 45 seconds. And again, for most people, this feels pretty good. It's a very light, small movement, but it actually feels like things are moving. So we're going to let that go. And again, we're just going to kind of move around. All right, so we've worked our way mostly around the ankle. We're going to come to the back of the ankle. So we're going to come all the way back into the Achilles tendon, which is actually called the calcaneal tendon. And we're going to check for tension. Which side do you have more tension on? The inside or the outside? So more at the top, more at the bottom?
Outside.
Okay, so you'd say more at the bottom. Okay, so we're going to take the tendon itself and you're going to move it toward the tension. So for Nick, the tension is toward the bottom. Okay? If the tension was more toward the top, we would bring our finger underneath and move the tendon this way and hold it for our 20 to 45 seconds. Okay, so move into the tension, not away from it. Not trying to stretch away from it. Move straight into it. And when we release that, we'll come back, just kind of test it again. Does that tendon move any easier? Wiggle it around. You can just grip it with your fingers. All right, and then we're going to finish with some more range of motion. Just move that ankle around. Oh, that was good. Nice pop there. All right, move it in whatever direction feels good to you. And of course you will want to do the other side, I would assume, or maybe not. Maybe you only have one ankle that needs to work. And that is our self-help video for the ankle.